Um, A very good morning to all. My name is Trashigang. I'm a physiotherapist currently working here in Trashigang Hospital. So today I'll be briefly talking about developmental disabilities. When we first talk about a disability, the first thing that we think is about physical disability. Uh, so disability is just not subjected to physical disability. When we talk about disability, it refers to everything: learning, example, physical, learning, language, or behavior. So when the term developmental disability, it refers to a group of conditions that result in impairment in a physical, learning, language, or behavioral skills. Usually, developmental disabilities occur during the early stage of child development. The severity of the disability, it may impact various areas of functioning like cognitive abilities, social interaction, communication, motor skills, and adaptive behavior. Some of the common type of developmental disability that we see in our community are intellectual disability. This may limit our intellectual functioning, example, Down syndrome and all. Autism spectrum disorder. This is a neurodevelopmental disorder that affects communication, behavior, and social skills. Cerebral palsy, it mostly affects our physical motor skills like movement, muscle tone, motor skills. Attention deficit or hyperactivity disorder. These are characterized by inattention, hyperactivity, and impulsive nature of the child. And learning disability, this involves difficulty in reading, writing, or calculation. Fetal alcohol spectrum disorder. This is similar to other. It also affects the physical, cognitive, and behavior development. It's mostly affected by alcohol exposure. Speech.
This forum is for your forum. So yeah, language is anything of it.
This speech and language disorder. This includes difficulty in learning, speaking, and delay in language development. The causes of developmental disability can be various. It can be genetic condition like Down syndrome. It can be prenatal factors like when a child is exposed to infection or maternal hand. It can be birth complication like premature birth, lack of oxygen, or breech presentation in delivery time. So environmental factor like lead poisoning, malnutrition, injuries, or illness during the early phase of life. Early diagnosis and intervention. Early identification of developmental disability is critical for providing accurate intervention and support. So when you talk about early intervention, so one early intervention is important because it is scientifically proven that in the early phase of child development, the child's brain cell is in a growing phase. So whatever intervention we give, the child has a greater capacity to react on that. That is one reason. Another reason is when the intervention is taken at the early phase, secondary complication related to the primary disability can be done away with. To start with early intervention, the most important thing is to have a proper screening system. It has to be screening, assessment, and diagnosis process has to be in the proper place. Assessment is just a Q&A, short question answer session. So in assessment, we don't properly in assessment. Sorry, screening. In a screening, is just a short Q&A session. So we don't take an in-depth assessment. The most common type of assessment that we use in Bhutan is Bhutan Child Development Screening. It is most probably mostly done by the HAs. So it just contains few questions. So according to this finding, the interventions are taken. So if in any of this domain, there are problems, and they are further referred for assessment. Assessment are more in depth. Assessment are more in depth, and mostly these are performed by the professionals. I think most of the ECCD facilitators are also trained in assessment taking. One of the most common assessment tool that we use in Bhutan is RNDA. This RND, it is a rapid neurodevelopmental assessment. There are two types of form, RNDA form and FA form. RNDA form is taken from 0 to 5 years, 5 age, and functional assessment form is taken from 5 to 9 years old. RNDA form covers the following domain. It is assessment on gross motor, fine motor, hearing, vision, speech, behavior, cognition, and seizure. These are the hospital referral system. So according to the finding, the child is referred accordingly. So if there's no impairment or mild disability or moderate disability, most probably the child will be advised with positive parenting advice, or recently I think most developed the technique is C4CD. I think HAs are doing that. Then if severe disability are suspected, then the child is further referred to respective doctors. Intervention, it depends on the number of challenges the child is having. So it it is related to cognitive, social, emotional, and physical development. So the key principle of effective intervention is individualization. What is individualization means? It is tailoring the intervention to a specific strength and challenges of the individual. Tailoring the intervention means formulating any intervention, be it rehab, be it skill training, anything specific to the strength and challenges of that disabled person. Family-centered, involving the family members in the process of intervention. Multidisciplinary approaches, it's a collaboration among various professionals like teachers, therapists, medical professionals. Speech and language therapy. The target group with speech and language delay or impairment, they usually work on articulation, language comprehension, verbal communication, social communication, and feeding and swallowing. Occupational therapy, individual with motor, sensory, or daily challenges. So they help individual with dressing, writing, and improving fine and gross motor skills. Physical therapy, they look upon mobility issues, those with cerebral palsy, with muscular dystrophy, developmental coordination disorder. So they focus on improving the motor skills, improving strength, balance, coordination, and movement. So medical and pharmacological intervention, they mostly focus on pharmacological intervention, like for ADHD, epileptic child. Social skills training. Children and adults with autism spectrum disorder, intellectual disability, and social communication difficulty. And these social skilling training are mostly done by the ECCD facilitators. I think this is just teaching a social skilling like talking, eye contact, understanding word clues. Special education services. This is targeted to school-grade children, mostly who have a difficulty with learning ability. So the best approach is making an individualized education program to provide tailored support based on the student's need. I think these we don't much use in the Bhutan schooling system, I guess. parent training and support, and involvement of parent in training for care, to care disabled kids. Family and community support. This is a support from the family and community for emotionally, financially. Social integration and life skilling program. The most, it's like vocational training, skilling the disabled kids. All these interventions are institute-based. So these institute-based interventions are most commonly used in foreign countries. It is much developed compared to Bhutan because Bhutan, especially disabled kids, that does not come to the institution to approach such intervention. So the best way how we can provide intervention into the community is through establishment of CVR. That's not a community-based rehabilitation. I'll give a brief summary of CVR. CVR, it is a strategy within the community development for the rehabilitation, equalization of opportunities, and social integration of people with disability. So CVR is implemented to the combined efforts of disabled people themselves, their families and the communities, and appropriate health, education, and vocational social services. They mainly focus on meeting the basic needs, ensuring the inclusion and participation and advocacy of the disabled. I think with this, I sum up my presentation.